Well, as of Thursday of last week, more than 480 cases of measles have been reported across the country, the majority of them coming from the southwest United States.
And the multiple outbreaks come as a top vaccine official at the FDA was reportedly forced out of his position last week. Our Washington correspondent Brendan Scanlon spoke with infectious disease experts about the outbreaks. Brendan?
Hey there, Renata and Nick. Good evening. Well, these recent outbreaks are responsible for more than 36 hospitalizations across the country. One death in Texas that's been confirmed, as well as potentially another death in New Mexico that is still being investigated. Measles is a highly contagious respiratory illness, one that could present serious health risks, especially to unvaccinated individuals.
Because they have no protection against measles.
Dr. Tina Tan has been studying infectious diseases for over 30 years. She says measles is one of the most transmissible and contagious viruses.
It only takes a very small amount of it to cause an infection, and it has airborne spread.
Measles was common in the 1950s and 60s. The introduction of the measles vaccine in 1963 and the measles, mumps, and rubella, or MMR vaccine, shortly thereafter kept the virus at bay until 1989 outbreaks among vaccinated children prompted the recommendation for a second dose. Fast forward to 2025, the virus is reemerging again, but for a different reason.
We have seen declines in the MMR vaccination rates, and there has been a significant increase in vaccine hesitancy and anti-vaccine sentiments.
According to the CDC, when more than 95% of people in a community are vaccinated, most people are protected through community or herd immunity. However, MMR vaccination rates among U.S. kindergartners have dropped from 95% to less than 93% in the last 4 years. It's a worrisome trend for experts like Dr. Tan.
The problem is you continue to let these vaccination rates drop, you're going to see more measles transmission in the community.
In an op-ed from early March, Health and Human Services Secretary Robert F. Kennedy Jr. said, quote, "Vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons." Renata and Nick, these recent outbreaks coming as the top vaccine regulator at the FDA was reportedly forced out of his position on Friday. In his letter of resignation, Dr. Peter Marks said his boss, Robert F. Kennedy Jr., the secretary, quote, "wishes subservient confirmation of his misinformation and lies," end quote. In a statement from HHS, a spokesperson said, quote, "If Peter Marks does not want to get behind restoring science to its golden standard and promoting radical transparency, then he has no place at FDA under the strong leadership of Secretary Kennedy," end quote. Reporting live on Capitol Hill for WENY News, I'm Brendan Scanlon. Renata, Nick, back to you.